Hello to everyone, and thank you for joining me on my weekly vlog. I have the pleasure today of introducing you to three of our medical officers of health, Dr. Etches, Dr. Kathryn Koliaska, and Dr. Albert de Villiers. I'm going to ask each of them to introduce themselves to you because you may not actually know them very well, but I want them to tell us a bit about what their role has been throughout the COVID response. So, Kathryn, I'm going to start with you.
Thank you. And so I have a split role as a medical officer of health, approximately 50-50 as the provincial lead medical officer of health for safe, healthy environments, and as one of the medical officers of health in the North Zone. I have day-to-day public health responsibilities, including the recently closed Manoir-du-Lac COVID-19 outbreak, which presented some unique outbreak management challenges.
Albert, I'm going to come to you next because for the North Zone, we know there's been some interesting challenges up there. So how has it been?
Yeah, it has been interesting. This the same as Kathryn. I've got two roles as well. In my one role, I'm the lead medical officer of health for emergency disaster management for the province. And the other lead is my lead medical officer of health role. For my provincial role, it's more of a behind the scenes role, supporting our really amazing provincial emergency disaster management team. And just wanted to say a shout out to them. Without them, I don't think would have been able to respond in the way we did. And in my zone lead role, it's more to work with local public health, the same as Kathryn, and working with Kathryn as well, and other partners to just address the issues as they come up. And that includes all our outbreaks in the work camps. We've had some very interesting community outbreaks, town halls with community leaders, and just the day-to-day contact tracing and follow-up coordination.
Nick, over to you because we know that Calgary's been a bit of a hotspot. So, man, you guys have been kept hopping. So, share with us the experience down south.
My job is to work here with our Calgary Zone MOH team to respond in many areas to the pandemic. And as you alluded to, Verna, our team has been extremely busy overseeing in the zone all of the case and contact investigations, outbreak management, and we've had a lot of activity in our long-term cares and some of the meat processing facilities, and then doing speaking engagements such as town halls and media, and then working really closely with our zone partners to make sure that public health is coordinated with the other areas of AHS and Calgary Zone, which have also been kept hopping for sure.
What's the typical day look like for you right now during the pandemic?
In the mornings, typically what it's been throughout the pandemic is we have our ECC meeting first, and then our ZOC meeting where I'll present the Calgary Zone MOH update, usually followed by a few calls, and then daily at noon we have our MOH huddle. And for the weeks where we had quite a few cases, we'd get a couple hundred emails a day, which our team managed together around all of the cases and their contacts and the outbreaks and the management of those, and working really closely with our communicable diseases team. And then throughout the rest of the day, it's meetings and phone calls. I do try to work from home, and then as well, occasionally I'll head over to the Calgary Emergency Operations Center to work with the Calgary Emergency Management Agency and give some presentations or visit our contact tracing team at the Sheldon Shumare. And then often, in the evening, it's just catching up on the flurry of emails. So that's kind of what my typical day has looked like over the past few months.
Albert, what's a typical day like for you?
I usually get up with the phone vibrating next to my bed with either another case or a physician who's got a tricky question that I can sometimes answer immediately, and sometimes I've got to go find the latest policy myself. And then it's the same as Nick as well, ECC meetings, ZOC meetings, committee meetings, task force meetings throughout the day. And strangely, sometimes it felt good because we got some regular work in between, like animal bites or vaccine questions. And it felt like a little bit of a break to deal with some of our regular jobs as well.
Kathryn, what's the typical day like for you?
I think what's made it really interesting, really busy, but really important is this undercurrent of urgency that we've all felt because we're racing against that COVID-19 clock. And we know that in public health that we have greatest chance to make the biggest difference early on.
Obviously, we've got a number of MOHs throughout the province. How much collaboration goes on between all of you?
As MOHs, we meet several times a week right now as a large group, and sometimes daily in various smaller groups, depending on what we're working on.
My next question is going to be for Nick. Can you tell us a bit about contact tracing and what this is going to look like in the future?
When you identify a case of COVID-19, you've got a little bit of time, depending on how long they've been symptomatic, before you would expect any of their close contacts who may become symptomatic and develop COVID-19. You've got some time before they would become infectious. And so what we're trying to do is we talk to the individual who's been diagnosed and give them the news and give them some time to digest that, ask them how they're doing, and then move into an interview process where we say, okay, if this is when you develop symptoms, your infectious period would have started 2 days before that. Give us all of the activities, every 10, 15 minutes, where were you? And who did you have close interactions with? And can you give us their phone numbers? And then we immediately contact those individuals and say, you've been exposed to COVID-19, and we need you to immediately self-isolate, and here's how you access testing, and are you symptomatic? And the idea, and this has been shown in the literature, is you can reduce or eliminate the amount of time that person is infectious in the community and exposing others if they were to go on to develop COVID-19.
What do Albertans need to keep in mind during the relaunch so that we avoid a big wave 2?
I think it's very important for people to continue practicing their physical distancing. And that actually means staying away 2 meters or 6 feet from people outside of a household, or like you said, your little cohort family. Because I've seen it myself as well, that people are starting to relax. We have had some cases in the north lately, the last week or so, where people started going back to their old habits and started having functions and barbecues with people outside of their close household, and unfortunately disease is spreading. So just want to make sure, and as well, still try to keep the indoor gatherings to less than 15 people and the outdoor ones less than 50. And even if you are there with those gatherings of 15 or 50 people, still try to keep your distance. Well, some restaurants are starting to open up again. Stick to your own plate. And I know it's difficult, especially sometimes with smaller kids as well and with very close families, but just as a precaution for now, it's probably better. And then there's all the things that we've always told people. Make sure you wash your hands. And then for our own staff, but also for all Albertans as well, to make sure that if you feel unwell or if you're ill, please stay home. Do the self-assessment online. Make sure you get yourself tested. Make sure we don't spread it that way.
Nick, over to you about some scenarios that you're planning for as we look into the summer and early fall.
We're all concerned about the potential for a second wave, and it's difficult to know exactly when that will occur. We've certainly seen it in some other jurisdictions. And so, on that front, the communicable disease team continues to work very quickly to scale up our contact tracing and outbreak management teams. We are going to be very focused on ongoing, robust outbreak management, making sure that we're communicating in an ongoing way to avoid public complacency. I think that's a real risk here. We're all tired from living the COVID life for so long, but at the same time, this has just as much potential to cause problems as it did at the beginning. And so, we need to remain vigilant as a society and change the way that we're living on an ongoing basis.
So being an objective MOH, Albert, what's your sense about how Alberta has responded to the pandemic and how it has fared in relation to some of the other provinces?
The majority of people have actually adjusted their lifestyle and really got the seriousness of the situation, and everybody worked together to flatten the curve. People are actually starting to understand epidemiology, which was great. And I think, I mean, just on the testing piece, I think currently we're still leading the other provinces in the number of actual tests for COVID done. So I think even from the lab side, from the MOH side, from the general public side, we've really pulled together, and I think we've done a really good job.
You know, we've all had to adapt to different ways of living, and the restrictions have really changed our lives for all of us. But as we know, in everything, there's always some silver linings. I know that you shared some of it with you, but if you had to point to one for each of you, what would that be that you'd want to share with everybody in AHS?
You know, what's been truly remarkable is the way that everyone has come together. And I remember early days, you know, when prior to the restrictions, but when work was happening frantically at AHS, I was spending some time with some friends, and they were asking me, you know, what was life like? It's, you know, in as part of the response, and it caught me by surprise. I became quite emotional, and it was actually quite a beautiful thing just to acknowledge the way that, you know, everyone was stepping up and the collaboration that occurred. It was like nothing I've ever seen in my life or my career. And you know, I think, you know, throughout this the course of this pandemic, you know, Alberta Health Services has we've really stepped up to the plate, and you know, it's made me even more proud to be part of this organization. So that's, you know, a huge silver lining for me. And then on a more personal note, I've just also really enjoyed how quiet society has been, in terms of just when everything stopped, I went for a walk and it was so quiet outside, and you know, obviously that's not something that can continue forever, but it was something I really enjoyed.
Great, thanks. Kathryn?
For me, right now, we're doing exactly what we've trained for in our public health careers. And so this is the real thing. The pandemic response, I think we alluded to it earlier, has really enabled us to focus in on a few priority activities and get things done in a much shorter time frame than usual. The other piece of it has been how broad our interactions have been with partners across AHS, beyond AHS, into government and other organizations, and the same sense of coming together in a very, very big sense that Nick was talking about.
Albert?
Yeah, as kind of as public health physicians, we've always impressed, and I would use the word nag sometimes, for people to wash their hands, cover the cough, stay home when you're ill. I can say those things in my sleep because we've said it to the media and to the public for, I don't know, I've been around for about 20 years in this kind of job. So I think at last the people seem to get it.
Great. I just want to say thank you for your words of wisdom and for passing them on to the organization. And I think on behalf of all of us, to the three of you, as well as to all the MOHs in our province, we are grateful for you and for your expertise and for guiding us and leading us in our response. So before I wrap up today, I want to send out some warm wishes to our EMS team across the province during the National Paramedic Services Week, which wraps up tomorrow. Our EMS crews have always been on the front lines of our COVID response, and our community paramedics were doing nasal swab testing back in February, even before our first case was confirmed in the province. Finally, I also want to thank all of you watching, as well as all of our AHS colleagues across the province. Yesterday marked 12 weeks since the first confirmed case of COVID-19 in Alberta, and I know that these 3 months probably felt more like 3 years for you, and yet you continue to provide the care for Albertans each and every day. Our number of new cases continues to trend downwards and in the right direction, and as we get deeper into relaunch, we know that our public health surveillance team will be monitoring the situation around the clock to make sure that we can take timely action if we see our hospitalization and ICU rates go up. We're going to need to manage this pandemic for the foreseeable future, a time that's best measured in months and not in weeks or days anymore. So let's just make sure that we continue to take care of ourselves and our colleagues, really helping ourselves get through this global health emergency together, and giving ourselves permission to make sure that we take care of ourselves and our families. So it means finding time to rest and recharge, maybe at different times of the day that you're not used to doing, seeking support when you need it, and always staying home when you're not feeling well. So Stay well, stay healthy, and I'll chat with you next week.
Together, we do amazing things every day.